Hi, my name is Carly Auer, and I'm a classical homeopath at Our Family Homeopathy in Mesa, Arizona. I have two children who have been raised on homeopathic medicine. Homeopathy has been such a gift in our lives, and I'm so happy today to be here to share it with you. I'm a graduate of the American Medical College of Homeopathy in Phoenix, Arizona, and on behalf of AMCH, we would like to welcome you to our new SelfHelp Homeopathy program. I invite you to visit us at SelfHelpHomeopathycom. We have 30 different programs in a variety of topics, from acute back pain to cold and flu to autism spectrum disorders. The great thing about these programs is that in addition to focusing on a specific ailment, they also offer an introduction to general homeopathic and holistic medicine. So if you've ever wanted to learn about homeopathy and how it can help you, this is a great place to start. Visit us at SelfHelpHomeopathycom.
Here is a brief clip from this program suggesting homeopathic remedies that are useful in treating this condition. The first remedy that I like to consider for sunstroke is Linoleum. And this is probably the number one remedy of all the remedies in the homeopathic pharmacy that we use for sunstroke and heat exhaustion. What is Linoleum? Linoleum is a remedy that is made from nitroglycerin. And you may be aware that nitroglycerin is a medicine that's used a lot in conventional medicine as well, particularly for angina or heart problems. Linoleum is a remedy that you should consider when there has been much exposure to the sun. Oftentimes the sunstroke or heat exhaustion comes on from overexertion, and these individuals are worse from overexertion. The face will typically be quite hot, and the extremities will be quite cold. The individual will appear pale with oftentimes fixed pupils or fixed eyes. If you look in their mouth, they'll have a white and dry tongue. Their pulse will be bounding and full, and their breathing will be labored. Some of the keys that can help you to recognize Linoleum is that they become confused fairly quickly, and they may not be making good decisions or recognize where they are. So this is a remedy that can early and easily go into a form of delirium. Also, they can be irritable. Sometimes they don't even want to be helped or recognize that they need help. There can be a fair amount of dizziness. That's worse on going upstairs or sitting upright. They're better lying down. One of the hallmarks of Linoleum is these congestive, pounding headaches that they have in their head. They're violent throbbing and also sensation of fluttering in the head with a rush of blood. And they cannot bear any movement or shock to the head. In addition to these throbbing sensations in the head, they'll also feel pulsations throughout the body. Typically with Linoleum, there is a fair amount of nausea and vomiting with a sinking feeling in the pit of the stomach. I would say that Linoleum is probably more useful for heat stroke or sunstroke than heat exhaustion, and oftentimes there is a high temperature associated. And this is a remedy that does tend towards convulsions from heat stroke. It's a remedy you can even consider when the person presents with being unconscious from sunstroke. It can help bring them back to consciousness. It also is a remedy that you can consider for the after effects of sunstroke, and that is an individual who has never been well since they had sunstroke. And that's not atypical. A lot of people, once they've had sunstroke or even heat exhaustion, are more sensitive to the sun thereafter for a long period of time.